Hey, Abby.
Hi, how are you?
I'm doing well. How are you doing?
Good. We have a little visitor here today and the baby carrier.
Beautiful. What a wonderful co-host.
Yes, exactly. Thank you. Hopefully she
Uh,
stays quiet.
yeah. Well, I'm so excited to talk to you today because the last episode we kind of touched on the attachment theory of breastfeeding, benefits of breastfeeding, maybe some challenges that come up, and why women don't persist in breastfeeding, even though around 80% want to in the beginning. So today I'd like to ask you a bunch of questions about what the first 5 days are like and how that kind of transition, whether you have the baby at home or whether you have the baby in the hospital, but what that first 5 days in feeding is like. So, um, yeah, I'd love to just
Yes.
first start off with the question. What is your recommendations when a mom comes to you before she has the baby? And what are your like big advice versus maybe a lactation consultant that they might see in the hospital and what their advice might be?
Yes. So I think we started talking about this last time a little bit, but you really just need to know um how important those early days are for your milk supply. And even though you're tired and you're recovering from your birth, um you and your baby are both kind of figuring this out together, and you and your baby, like you following the baby's cues and then latching the baby on effectively, is what's going to bring in your milk supply.
Mm,
So you know and it's a reciprocal relationship where, like, the more they suckle at your breast, the more that gives your body the message to make more milk and
mhm,
kind of get through the early colostrum stage to the full mature milk supply, that's gonna last you your whole breastfeeding journey, however long that is. So I think what people really need to know is that within a couple hours, like 1 to 2 hours after the baby's born, that's when you have to start getting them on. And then it really should be cue based. Every time they cry, every think hour or 2 hours, like anytime they're alert, because we can share a story about this later. But there is, I think, a lot of misconception where people think like, oh, the baby's sleepy, let them sleep for 3 hours or something. Like, you only have to feed them, 8 times a day is this magic number. And it's like, well, not really. Like, you really,
mm.
it needs to be like eight minimum, but like 8 to 12 times a day within the first um, couple of days to really send that strong message that, okay, there's a baby here. We need to make the milk and
So
get this
interesting.
going. Hmm.
Yeah, we talked about that last episode a little bit of mom's active role
Hmm.
in helping her milk supply come in by putting the baby on her breast. And that's an interesting point about not being so like being flexible in the every 3 hours or 8
Certain
hours.
amount of time. Yeah.
Yes. And I guess as a person who doesn't have children and has never breastfed before, I'm like, so not to get controversial, but you hear about these scheduled feeding that just are like available in books and things like that.
Hmm.
And I guess, what benefit is it to kind of be more Q based? And can you go more into Q based?
Yes, yes. So I think that we're a generation that just really loves information, right? Like, we've always had a lot of information at our fingertips. And so we love to hear, a schedule that says like, okay, feed the baby at this time, nap at this time, whatever. And newborns just really can't go by that because every baby's different. And like, we need to, like, as they're learning this new skill of breastfeeding, what if they have one feed where they were really sleepy and it wasn't a very good latch and they kind of were falling asleep at the breast? Then we better be giving them another chance to make up for that, an hour
Yeah.
later when they wake up and they realize, oh, I am still hungry, let me get on more, and then have a better feeding. Whereas, like, if we and also, as the observer, like, when you're just learning how to breastfeed, you don't really know what a good feeding looks like, right? You're like trying to see, you're like, I guess they're latched, like, I guess they're transferring milk, I hope, but they're very sleepy and they might be just doing a shallow latch on the tip and not really transferring a lot of milk, and you have no way of knowing that yet. And
Interesting.
maybe that's going to turn into like this long-term problem that you're working out, or maybe it's just that they're new here and they're learning and you're
Right.
learning, and like you just haven't figured it completely out yet. So we just want to be feeding them so often that they kind of have time to practice and work out those kinks. But this
Mhm.
reminds me of this story where I saw a baby in their house for a 3-day-old lactation consult recently, and the mom was like, "Hey, my friend told me to use this mom's on call schedule," which nothing wrong
Mhm.
with it. Like there's these popular schedules that just I think give people security. There's also a lot of
Yeah.
apps. Like I almost every mom I meet is like tracking the baby's feedings and everything, and it's like you know, I get why you feel like you need to because you want to have a reference point. And I think
Yeah.
there
Right.
is help, like there is a point to it. But I think if you are able to just look at their cues and you
Mhm.
know that they're at least doing it every 2 hours ish, um, then there's really no need to track because 2 hour if they're doing it every 2 hours, that would be 12 feedings a day. So that's like on the high
Yeah.
end. Um, and maybe they would even be doing more because if you're really going based on their cues, they might eat, fall asleep, and then cry and wake up again, and then you feed them again, you know.
Wow. Yeah.
And eventually it will get more spaced out. I know we can't do that forever, but in the first 2 weeks, when really your only job, hopefully, is to be with this baby and learn how to breastfeed, that is just, I think, how you really establish breastfeeding in the most easy, stress-free way.
Yes. Well, I love that they're new here,
Yeah. Yeah.
and that, right, talking about these reading your baby's cues, like, as SLPs, well, almost an SLP for me, you learn how to read your baby's cues, like, at a young age so that as they grow up, you can actually read what they're trying to say or their communication attempts as they
Mhm.
develop. And so it's just really interesting. My a follow-up question to that is, like, what do baby's cues look like? Like, how do I know that my baby wants to eat?
Yes. So in those early days, it's really just alertness. Like even if they're just
Mhm.
starting to stir, like their eyes are still shut, but they're just moving their hands or moving their lips, anything is a cue. Like, oh, I'm waking up. I'm ready to participate. Now, if they're totally asleep, they're probably not going to be able to participate. So
Right, right.
so that's like an I'm done cue or I'm tired. But we want them to be kind of active and alert at the breast and then
Mm,
eating and then they fall asleep again. So their wake windows are very short in the beginning. Like maybe they're only awake for like 30 minutes. So if you're staring at your baby and looking at your baby and oh they're so cute, they're staring at me like that's feeding time. So in the
yeah.
beginning, any alert time is feeding time. Then,
So
and then and it changes a lot. This is also what I always tell parents is helpful to have a lactation consultant kind of with you along this journey because
yeah.
actually in the first couple of days, like let's say it's like day 3 and you've been trying to be cue-based and watching for their alertness and feeding them whenever they're alert and whenever they cry. Crying is actually like a late feeding cue. So it's like, oh, they're actually like really hungry now.
Uh-huh.
But if babies aren't feeding well, and this is confusing, they actually can start getting more sleepy. So then, because they aren't feeding very well, then they start kind of shutting down and like protecting themselves because they're like, I got to conserve my energy. So they actually don't wake up for their feedings. And so it'll be 3 hours. And so a red flag for me is if I get to your house on day 3 and you're like, oh, my baby just sleeps for like 4 hours. Like they're just so sleepy. I'm like, ooh, that's not good. We got to get this baby eating and waking up.
Yeah.
So, so yeah, so there is something that you might hear, like it takes 2 weeks, that the pediatrician and everyone is kind of looking for the baby to regain the weight they lost back to their birth weight. And some babies do it much sooner, but it really at the last day it should happen is day 14. So in those 14 days, we kind of should be waking them up. Like if they're like, you know, um, let's say they've been sleeping for 3 hours and they're just so cozy, maybe just go change their diaper and see if they'll wake up. And then usually they do, and then they'll
Mhm.
feed. Um, and then yeah,
Can
so
you
that's
ever wake them
interesting.
up by feeding them? Like,
Yes,
would that be
totally. You could
appropriate?
just
Okay.
yeah, you could I mean, yeah, if it's been a good amount of time. I mean, I don't, of course, like if a baby's totally asleep, we don't want them to be like, we don't want to shove a bottle in their mouth because
Right,
then
right.
they could choke and that's not good. But
Mm,
so we do want them to be alert to participate. But I will say with breastfeeding, I think you could wake them up and kind of like put them around your breast and have them smelling the milk. And they might even sleepily with their eyes shut be like, and start
yeah,
eating, start latching on.
right.
And then they're kind of, they are participating, they are alert, you know.
And I guess in regard to breastfeeding, like, can you overfeed via breastfeeding?
That is such a good question. You really can't because it
Mhm.
is the baby is in control of how much they are sucking. Now, I will give you a little personal example.
Yeah.
My baby was, and a lot of times with second time moms, your milk comes in really fast. And
Mm,
because every pregnancy, you actually lay down more breast tissue. And so you're you actually do have the capacity to like make more milk the second time. And people a lot of times are like, whoa, my milk supply, like I struggled maybe on the first time, but the second time, not only do I know how to breastfeed because I've already done this once, but my milk just comes in so fast. And so like on day two, they're already, the baby's transferring a ton in a weighted feed or gaining weight back to birth weight really quickly, things like that. But with what happened with her is I think she was overfeeding a bit. And so you can't really overfeed a breastfed baby in a bad way because it's all like so nutritious for them.
yeah.
But what you can do is give them a large quantity of milk and then they spit up a lot. And so
Okay.
she was spitting up. So they kind of self-regulate that way. Like some babies are really spitty babies, some aren't. And with bottles too, like if you notice your baby's spitting up a lot, it could be that they just have reflux, or maybe you're giving them a little too much in the bottle. We can decrease that. With the breastfeeding, it's a little harder if they are spitting up a lot. Um, you know, different problem. We can talk about troubleshooting it, but like I tried to kind of monitor how long she was on there and kind of see if I could get it to where she wasn't spitting up quite so much. But I would
Yeah.
say that's usually not as common of a problem.
Wow, that's so interesting, the self-regulating piece.
Yes.
And
Mhm.
it reminds me of what we you talked about last episode was
Mhm.
that the one of the benefits of breastfeeding is that it promotes like satiety cues, like it
Yes.
develops satiety cues like of a baby being like full, I'm hungry, I'm full, I'm hungry.
Yes.
And yeah,
That's so
it's
cool.
it's interesting too learning about in my clinical experience right now in the NICU that babies start swallowing amniotic fluid in the womb. Like though they're
Okay.
receiving their nutrition from the umbilical cord
Yeah.
or placenta, they just get
They're
swallowing practice. They're
Yeah, they're
already
already
learning.
practicing in there. And that's why I think I also touched on this before that like if they do have a tongue tie or like they're having some problem with their palate or oral function swallowing, like they've already been developing these patterns the whole entire time. So that's why some babies that if there actually is a problem in those early days, like let's say that you can't get the baby latched on no matter what you do, like you've had a lactation consultant come by in the hospital and they just can't get the baby latched on and it's hurting really bad when you latch on or just the baby falls asleep right when they get on or there's so many issues that can happen and sometimes it really is like a structural or functional oral motor issue that people always just say tongue tie, but it could be any oral motor issue that needs to be evaluated by like an occupational therapist or a speech therapist or lactation consultant that has been trained in infant feeding. Like, because there's a lot of those different professionals that don't exactly always have all the training on all the different things that can be going on with your oral function.
So at what point in your feeding journey or
Mhm.
in one's feeding journey would they be like, okay, I think my baby has a tongue tie, and not only do they have a tongue tie, but it's worth
Getting
seeing
it.
someone out, right? Like perhaps, yeah,
Yeah. I would say if you're having problems like in the hospital, if people are already telling you like, or if you're like, oh, it hurts so bad every time I try to latch this baby,
yeah,
already I would be trying to make an appointment for when you get home. And like I said before, I would make an appointment even if things are going great, because
Mhm.
I'll tell you this story in a minute about that. But like yeah, like if there's a problem, 100% get a lactation consultant
Sponsor.
on board, which is usually covered by insurance, or an SLP or OT that does this, that does infant feeding. And you can use the lactation network.
Mm.
Anyone can go on there and look for a lactation consultant in their area, plug in your insurance, and it usually will cover 6 sessions at least. So, and I see patients through there. I think it's awesome that, there's that access to care, because that's one
Yeah.
of my frustrations as a speech pathologist, was that like it was harder for people to either pay for my services out of pocket, or even for me to get insurance reimbursement when I've worked for private practices. Um, and I do think we've done a lot of, work to get lactation care funded.
That,
Um, yeah.
just a note on the 6 sessions, like that's
Yeah.
really interesting that it is 6 sessions because you can learn so much in 6 sessions. And that kind of answers a question of like, okay, I saw a lactation consultant in the hospital. Why would I need to see one at home? And
Because it
so,
changes so
yeah,
much, I think. And just because
yeah,
because to see if the baby is like continuing along what we want to see in those first
yeah.
early 5 days, and then 2 weeks are really the time that you kind of figure it out. And then I would say by like 4 to 6 weeks is usually when things are getting sorted. And then that's usually when you try to introduce a bottle. So we can also help with that. So I would say like that whole early journey of like establishing breastfeeding is kind of like a month long process of just
Mhm.
making sure you work out all the kinks, like if you're getting engorged, like so many things that can come up. And like you
Yeah.
said, 6 sessions, I think, is kind of, I usually see people for like 4 to 6 sessions. And I feel like by that point, like they're on some kind of plan and sustainable situation that they feel good about.
Wow, that's awesome, especially because those first 4 to 6 weeks are so key in the whole feeding journey. So
Mhm.
if you have access to that care, especially under insurance, why
Yeah,
not? Why
exactly.
not get that help? That's interesting too, because you spoke to this, I think before we started recording, but
Mhm.
that every day in the journey with an infant is different. And so you might receive care in the hospital or your birthing center or wherever from a
Mhm.
lactation consultant, but the next day you leave. You know what I
And
mean?
then you don't, then you're Googling.
Literally,
Yeah.
literally, yeah.
Ugh.
And it's like no, and then who do you call? Your mom, your sister, perhaps. But if they bottle fed or they had
Yeah,
their
maybe you
or
don't
you
know.
don't have sisters, yeah.
So I
Uh,
actually had a client that I just went to, that I was going to talk about,
oh yeah.
that I went to their house, and they were trying to do the moms on call schedule because they just, their friend told them to do it. But maybe their friend did start it from the beginning, but maybe not. Like the really you can't do it until you kind of establish everything. So you need to be just going cue based, like we were saying, feeding them whenever they're alert so that you get enough feedings in. And then maybe they will be able to sleep a little longer at night because you've done
Mm,
a lot of feeding during the day, but it's still probably going to be up every 3 hours. Their circadian rhythm is not developed yet. So we're not trying to go for long stretches of sleep at this point. Okay.
right.
And yes, that's hard. So we do need to talk about like other supports, like the village mindset of like having a partner or a mother-in-law stay with you, or some people, if they have the means, like a night nurse or like a friend to come let you take a nap during the day. Like there's other things we can put in place to help you get sleep. Um, but for those 2 weeks, trying to really respond to the cues, feed as frequently as the baby wants to. And
Mm,
then once the baby is um, more back at birth weight, then things can start to spread out a little bit. And then if you want to be more scheduled, you
can
can.
do that. Yeah.
Um, yeah, you can try to do that. But yeah, I just, that case was interesting to me because the baby was not gaining quite enough weight doing it that way, doing
Mm,
it with the moms on call way of every 3 hours. But I could tell with assessing the baby that the baby's oral function was good. The mom's milk supply was coming in. It looked good. The mom was actually latching really comfortably and well. So I could tell like, and even when I measured how much the baby was transferring a good amount of milk for the time, it was just like, oh, she's not feeding this baby frequently enough because she's trying to follow a schedule. And so then I told her, hey, why don't you just go cue based? Like, you're really good at responding to our cues. It could be more like every 2 hours. And so just having that mindset shift of like, oh, maybe I should look for it because it is confusing. This baby's sleepy. Like maybe at
Yes.
2 hours the baby was stirring, but maybe she was like, oh, she went back to sleep. Oh, I'll just watch another show. Like
Right.
you're not doing anything wrong. You're just not, you should kind of think of it as like, this is my job for these 2 weeks, like feed that
Yeah.
baby and
Yeah.
as much as you can. And then if you have that mindset, I think then the baby will gain weight faster. So long story short, she changed her plan and she started feeding more frequently. And now the baby's gaining more weight than they need to be. Like the baby's right on
Wow.
track, gonna get back by 2 weeks, and she didn't have to supplement. Now, another situation that can happen is like, let's say you actually do need to supplement because, like we said, like you're not getting the baby on, they're not latching, they do have neural function problem. Then having a lactation consultant to help you work through that is also super helpful. And then we can put into a place a plan that like protects your milk supply in the meantime. Maybe you're giving them some bottles because it helps them get the milk more efficiently and get back to birth weight so that you aren't wasting all this time and energy for the baby of like trying to get the milk and then the baby's tiring out and not getting what they need and then you're exhausted. It can become a vicious cycle quickly
Yes.
if it's not going well.
Well, and I love that story
Yeah.
about the mom because, like, you don't know what you don't know. And she was doing everything right. She was
Yeah.
doing everything what she thought. It just was
Yes.
like small tweaking of being like, why don't you go Q based?
Yeah.
And then also one thing is like when I'm going through a challenging time where I'm like, oh, I'm working real hard. At knowing that there's an end in sight is so helpful and being like,
Mhm.
okay, 2 weeks,
I can do
you
this
know?
for 2 weeks.
Yeah.
Yes. And I think that is a good mindset to give people, like the 5 day marker, the 2 week marker. And even if something is going wrong, like when I've worked with families where they're having to pump and bottle feed and all this, they're like, how long am I going to have to figure this out? Like I only have, 6 weeks off work or 12 weeks off work. I
Yeah.
I do, I I hope I don't get myself in trouble, but I try to like give them a little bit of a timeline because doctors will never give you
Yeah.
timelines of things. Like I knew that from being a NICU mom, like they would never tell me when we were going to go home. But if I had just had like somewhat of a
Yes.
marker, I think I could have like mentally handled it better. But
And
I say that to moms. I'm like, you know what? Let's do this for 1 week. See, or I'll tell them like usually with this problem, like it does take like 2 or 3 weeks to figure out. So let's just make sure whatever plan we're doing now is sustainable for that time. And if it's
yes.
not, then we'll change the plan. Like there's always so many options of what you can do.
And even if it does take longer, at least
Mhm.
knowing that, like, okay, I did this for 2 weeks. Like,
Mhm.
okay, if it's gonna be a week longer, then it's gonna be a week longer, and like I can do it. Like you're building self-esteem as a mother,
Yeah.
And that's it's so empowering in my
Yes.
mind. Yeah, it's like a really beautiful piece of your whole journey of being a mother. It's like, okay, usually,
Yeah.
yeah, it can go if it starts well, then you already have a good foundation with yourself, a relationship with yourself of being like, I see myself as a person who can provide for my child. So,
Yes,
yeah,
yes. You can
that's
make the decisions I need to make along the way when things are changing, you know?
yes, which
Yeah.
is what we talked about last episode of like, okay, like the purpose of this podcast is like informing yourself and then using your intuition, like
Mhm.
you like taking the knowledge and then using the knowledge, and if you have detours in the path, then you know what decisions to make for your baby. And
Yes.
so yeah, that's really what
Love
got me
that.
here. Yeah.
Yes.
So okay, when you talk about cue based
Mhm.
and you talk about like just pretty much whenever they're awake for the first 2 weeks. Well,
Mhm.
what about after that? Like what and for bottle feeding, like what do these cues look like?
Like
Yeah,
yeah. So I would say the really early days is kind of like whenever they're awake. Then they start getting a little bit more predictable like when your milk is more fully in, so it's not quite colostrum and they're getting a little more alert. So I would say like let's say day 5 to like the end of the 2 weeks, it
yeah,
might start looking, yeah, it might, it's, we still say on demand 8 to 12 times a day. So really it's like their hands are to their mouth, they're waking up, they're starting to stretch. Those are the early cues, like kind of like some mouth movements, tongue movements. And then the late cue is like
Mhm.
crying, like really
Yeah.
waking up and crying. And then they're definitely hungry. Um, Now, of course, after a feeding, like people will say, how do you know that they're full? Well, so you latch them on. It should in the beginning take kind of a little longer because they're still figuring it out. So
Okay.
I would leave them on there for like 30 minutes, like maybe like 10, 15 minutes, 10, 15 minutes, and always offer both breasts in the beginning
Okay.
because you kind of want to stimulate both sides and make sure they're getting enough and um all of that. And I would be like actively like kind of looking for milk transfer, like, and I just think check with a lactation consultant to have them observe because you don't know what you don't know.
Yeah.
But they'll tell you to, they're obviously not going to be there every feeding. So they'll tell you, make sure you're kind of making sure they get a deep latch, staying on the whole time, really like swallowing, seeing that jaw movement, not just nibbling on the breast, but
Mm,
really swallowing. You can
missing
hear the
it.
swallows, you can see the milk. You can kind of start to notice what it looks like when it's a good feeding, when it's going right. And
Okay.
then if there are any red flags, like if you notice, oh, they get a shallower latch on one side, I need to make sure I do this position. Some people do football hold on one side, whatever. Then you kind of do those things to help them compensate or like lift their top lip a little bit to help them get a wider latch. Some
Okay.
people don't use this without, talking to a lactation consultant, but some people need to use a nipple shield in the beginning to help with it. We try not to do that because that usually is like a band-aid issue or a band-aid solution for like a deeper issue. But there's different ways that you can try to get the baby just having as efficient of a breastfeed as possible in the beginning. And then I would be doing that, and then it might turn into where it's like only like 8 to 10 times a day because they're getting better at it, and
Yeah.
it starts to fall into more of a predictable pattern, and that's great. As long as you usually go to the doctor like around day 5 and then again at 2 weeks. So I would say, if it's on a good trajectory by that point, then that's great. If it's not, then that's when I would get a lactation consult if you haven't already, so that you have like, that it's turning around in the right direction before
Yeah.
the 2 week mark. I wouldn't want to wait till the 2 week mark and then find out like, oh, we haven't been feeding effectively this whole time.
Yes. Yeah. Definitely more be proactive.
Yes.
Yeah. In the process.
Mhm.
Okay. To know, as someone who has never breastfed before,
Yeah.
colostrum, what are the benefits? What's the rage? What is it?
So it's the early milk. It's really no different. It's just thicker, yellower, more nutrient dense. It's just the early milk that comes in like in the first 2 days, basically. And even before you give birth, you can express colostrum. That is something that I wish more first time moms knew about. And I think first time moms are a little timid to even do this, just because they don't really know their body yet. They haven't even given birth yet. So they're like, this is weird to just like squeeze this stuff out of my nipples. But basically, you can, and it's just like that. But that basically teaches you also how to hand express, which is like basically just pushing back on your nipple and squeezing out colostrum into a little vial. And like, it's not rocket
Interesting.
science. You're literally just squeezing it out. I remember even as a lactation consultant being like, it sounded like so mysterious, like witchy. Like, I'm like, oh my gosh, what is this? But you literally just take a
Squeeze.
shower and squeeze out the little drops. And then you put it in a vial, you freeze it in your freezer. And I think that's like the best tip because you start getting to know your body a little bit, like
Yeah.
it, and then and that just helps you when you're trying to latch the baby because you're like already kind of know how to like get the milk out. And there's videos and things online about like how to do hand expression properly, but anyway, if you have some of that already, then when you have the baby, if the baby isn't latching well, you have this liquid gold to put into a bottle. Or you don't even have to start with a bottle. You could start with just like little syringes. Like if because in the beginning you don't know if it's just going to be a latch problem temporarily or if it really is like going to be a problem. And if it is,
Yeah.
then we need a more long-term solution like a bottle. But like
Yeah.
if it's going to be one feed or two while you guys are figuring things out, then just do a little syringe so that they,
Big
are
deal.
still trying at the breast.
Yeah. Wow. And then if they're trying at the breast, then they get some benefit and they're like, "Oh,
Yes.
wow, that was
Oh,
good."
milk's coming
And
out. Yeah, this is
yeah.
great.
Yeah. Oh,
I
that's
should stay
so
around here.
that's for real. Let me
Yeah.
more often. Well,
Yeah.
and like neural development, duh. Like they're like, "Oh, their
Building
brain is
associations. Yeah.
yes, their brain's like, "Oh, I do this, I get good." Like I
You
get
get milk.
something good.
And that's something that I think a lot of why second time moms are so much more successful is because you kind of know how to, like, be patient with it. Like,
Mhm.
with my second, like, it's not like it was, like, so perfect. Like, it was a lot easier. Like, I do believe my first had a tongue tie and my second didn't. So, like, that was a huge difference. And my first was premature, my second wasn't. So, like, there's a lot of differences, but like, I remember her crying and not really getting a good latch, but I kind of, like, held my boob and held her neck, like, her
Yeah.
little supporting her neck, and I kind of, like, was like, "Come on, keep
Okay.
going, you're here." Like,
Yeah.
like, kind of, like,
Right.
you kind of
Right.
have to teach them too, but I think
Yeah.
what's hard is the mom doesn't feel that confident the first time because 'cause you're like, "I don't even know what I'm doing, so how am I supposed to teach this little baby how to do
Right.
it?"
Right. Well, and
Mhm.
that just speaks to the point of like we need to more openly have conversations about breastfeeding and more openly breastfeed of like,
Like, the
yes,
details of it. Like, because people
yeah,
will just be like, "Oh, yeah, I had latch issues in the beginning, but we figured it out. We had a lactation consultant," and that's, like, the end. But
right,
it's
right.
not like, how did you actually figure it out? Like,
Yeah, or
how
we switched to a bottle and it was fine, and I
Yeah.
cried or whatever. And it's like, no, like and like,
Yeah.
but also share your story. Like share your story so that
Yes.
yeah, so that's I feel like we both have that goal for this podcast of like
Yes.
we want it to be a platform in which these topics aren't like unnecessarily taboo, and
Yeah.
women can talk about their feeding experiences so that other women can learn from them.
Yes.
Um,
And it
yeah,
can be like, we would love just to hear everyone's different thought processes, like if you remember, which I'm sure we do, like when we talk about our birth story, we talk about like how we decided each part along the way. How did you even choose a provider? How did you choose to do a home birth versus a hospital, then an epidural versus not an epidural? Like I feel like we're more accepting of like all the different ways birth can go, but
yeah,
we're not as accepting as like all the different ways feeding can go. And usually if you talk to most women, like no one has the exact same story. Like some
no,
people, fully breastfeed all the way and never even get a babysitter because they just are breastfeeding the whole time and no
yeah.
bottles. And then some women are like, I'm doing formula from day one. Or some women are like, I couldn't figure it out at first and I was supplementing and had this whole journey and then I started breast like there's
Right,
just so
for the
many
second
variables.
babysitter. Yeah, yeah. I'm getting
Yeah.
curious about other people's stories so that we can just have open conversations about it,
Yes.
is really something
And
awesome.
learn from them. And then this could be a way for people to learn, like, okay, now I know about how to collect colostrum. I
Yeah.
might still not feel confident doing it, but maybe I'll look up a video and maybe I'll just do that as a first time mom because I want to, in case I have latching problems, like I
Mhm.
just have this little magical, and I had that the second time and it helped because she was in the NICU again for another thing. And, it was a shorter than my son, but I was able, like I had milk to give her which was
Yes.
just helpful, like, as I was trying to pump and get my milk to come in.
Yeah, and we've talked about this
Mhm.
before, like, kind of the gatekeeping, weirdness around infant feeding, and, like, we want to open the gate, we want to let the stories out and just provide a space for women to share. So,
Yeah,
thank
I
you,
love
Abby.
this.
Yeah, thank you
Yes,
for
thank you.
sharing,
Thank you,
answering
Catherine.
all the questions, and, until next time.
Yeah, see you next time.
Alrighty. Bye.
Bye.